During and after your stay in the hospital, you may experience some of the following physical symptoms: tiredness, shortness of breath, body aches, loss of taste and smell, sore throat, cough, changes to your voice, headache and fever. If you have had a stay on critical care, intensive care unit or high dependency unit, you may also notice problems with your memory, difficulty swallowing and sleeping, and nightmares. These are all very common problems. This production gives some helpful techniques to manage some of your symptoms during and after your stay in the hospital. Symptoms of coronavirus are different from each person, so some of the techniques here may not help you. Just use the ones which apply to you. Breathlessness. If you feel your breathing is getting worse or you experience new breathlessness, it's important to get medical advice. Here are some general advice. Avoid breath holding during activities. For example, climbing stairs or bending. Try to blow as you go. This means breathing out on effort, such as when bending, lifting, reaching or standing up from a chair, or when walking. Try to avoid rushing. Try matching the rhythm of your breath to your steps. For example, take a breath in and out on each step when climbing the stairs. Sometimes, a fan directed towards your mouth and nose can help reduce feelings of breathlessness. Pursed lips breathing. Well, some people find breathing in through the nose and out through narrowed lips helps to ease their breathlessness. This technique tends to help people who have breathlessness. People who find this helpful often use it without realizing they're doing it. Pursed lips breathing helps to keep the airways open, allowing the air to leave the lungs more easily. This creates more room for the next breath in. You can use pursed lips breathing at the same time as relaxed tummy breathing or recovery breathing. Positions to ease breathlessness. These positions may help to ease your breathlessness at rest and after activity. Experiment with and adapt different positions until you find what works best for you. Leaning forward may also improve the movement of your diaphragm, the main muscle of breathing. Make sure you're fully over on your side. Resting your upper arm on a pillow may also help. Relax down onto the pillows as much as possible. Having your legs apart may also help. Positions to ease breathlessness immediately after activity. The following positions may help to ease breathlessness after you have been active. With all positions, try to relax the hands, wrists, shoulders, neck and jaw as much as possible. Experiment with your arm position. Does your breathing feel easier with your hands behind your head or back? If it does, do that often. Fatigue management. Tiredness is a common symptom in coronavirus. It makes you feel less motivated to keep active, which means that often you avoid activities. This can lead to you having even less energy, which can make you more tired. If this behavior becomes a habit, the cycle can often be difficult to break. We cannot take away your tiredness completely, but there are a number of ways you can manage it. These might help you to do some of the things that you would like to do. Here are some ideas to help you manage your fatigue. Pacing. Slow down your activities as they will take less energy. Slow down when you talk, eat or cough. These actions can affect your breathing pattern. Break down your activities into smaller tasks that are more manageable. Allow yourself some time each day to try to relax. Remember, it is better to take a little extra time to complete a task and be able to continue than to finish the task quickly and feel too tired to continue. Positioning. Try to avoid too much bending and twisting, which can be tiring. Don't sit or stand for too long without changing your position. Think about trying to organize your home so that things are where you need them. For example, in the kitchen or in the office. Have frequently used items nearby. It takes less effort to push, pull or slide objects. So, try to avoid carrying heavy things. Expectations. If you're placing high expectations on yourself, it is worth having to think about allowing yourself to do things in a different way that helps with your energy levels. Try to be patient with yourself and give yourself time to do things. Try to recognize the things you're achieving. Try not to feel disappointed if your recovery seems to be slow. We expect a range of time frames for the symptoms you're experiencing to improve. Activities. It is important to stay as active as you can. A little regular, gentle exercise each day can make a big difference. This can be a walk, a run, or gentle resistance training. It is also important to graduate your return to exercise slowly and steadily, increasing how much exercise you do. Speak to a therapist if you need any assistance with this. Sleeping. Even if you're not sleeping at night, try not to sleep during the day. If you do need to sleep during the day, try to keep this down to a short nap rather than a prolonged sleep. Remember, these symptoms will likely improve as you recover from coronavirus. Anxiety and stress management. Breathlessness can often cause anxiety and feelings of panic. Anxiety tends to make the feeling of breathlessness stronger, which leads to more anxiety. It is important to remember that breathlessness in itself is not harmful and you will recover by breathing when you rest. It is also possible to try to control the level of anxiety you're feeling, and relaxation is one way of doing this. Relaxation is a useful skill that you can learn. Preparing for relaxation. Relaxation is not always easy, but the more you practice, the easier and more effective you will find it. Try to allow yourself some time each day to practice your relaxation exercise. Tell the people you live with that you will need at least 20 minutes undisturbed every day to practice relaxation. Make sure the light and temperature of the room is at comfortable level. Managing changes to your swallowing and voice. You may experience difficulty swallowing, which can include coughing when eating or drinking and changes to your voice after coronavirus. This can be because of lots of coughing and/or inflammation from a tube that was inserted into your throat to help you breathe during the illness. These changes are likely to improve as you recover from coronavirus. Here are some safe swallowing strategies. Difficulty swallowing certain foods, liquids or saliva can occur in varying degrees after coronavirus. Here are some general safe swallowing strategies designed to help you with your eating and drinking. If you notice changes to your swallowing, it is important that you discuss this with your doctor. Make sure you're sitting as upright as possible. Even if you're in bed, try and set the bed up so you're as upright as when you sit in a chair. Minimize distractions, including talking to people whenever you're eating and drinking, to make sure you're focused on the task. Eat and drink slowly, making sure you take one sip and one mouthful at a time. Avoid eating and drinking when you're particularly tired. Try having smaller meals more often to allow for fatigue. Make sure you maintain regular oral care. General advice for your voice. Always aim to use your normal voice. Don't worry if all that comes out is a whisper or a croak. Avoid straining to force the voice to sound louder. Avoid attempting to talk over background noise such as music, television or car engine noise, as this causes you to try to be louder, which can be damaging. If your voice is no more than a whisper, do not try telephone, online chat or video conversations. Once your voice starts to improve, avoid prolonged more than 5 minutes voice conversations. Try to use text-based options instead. You may notice that your voice fatigues more rapidly than normal. This is to be expected. Take a break from talking when you experience vocal fatigue or soreness in your throat. 30 to 60 minutes will give your vocal cord time to recover. Keep well hydrated as this helps your vocal cords stay well lubricated. Use steam inhalation if your throat feels dry. You can do this by putting hot water in a bowl, placing a towel over your head, leaning over the bowl and inhaling. Use hot but not boiling water to avoid scalding. Try to avoid persistent, deliberate throat clearing, and if you can't prevent it, make it as gentle as possible. Taking small sips of cold water can help to suppress the urge to cough. Try to relax when speaking, especially your shoulders, head, and neck area. Until your voice has returned to normal, it is best to avoid athletic vocal activities such as shouting and singing. Are there any things I should avoid? Yes. Alcohol, cigarette, caffeinated drinks, spicy foods that may cause acidic reflux, that is, acid that comes up from your stomach and irritates your throat. Healthy eating following recovery from coronavirus. Eating well and maintaining a healthy weight is important to keep you strong and fit and help you fight infection and recover from illness. It is important to think about your weight. Complications and conditions associated with being overweight, such as type 2 diabetes and heart disease, can increase your risk of becoming more seriously ill with coronavirus and can impact your recovery. If your body mass index is over 25 and you're thinking of losing weight, doing this during or straight after an illness may not be the best time. Instead, wait until you have recovered fully. Talk to your healthcare professional about when will be the best time for you to lose weight. Try as much as possible to eat well to help you stay nourished. For more information, visit the NHS website www.nhs.uk. Happy recovery.